nursing department is a vital point on which other departments rotate for an hospital to function. A patient coming into the hospital, go through the nurses, right from admission, even to the point of discharge. Okay, right from admission to the point of discharge, it's a nurse that make sure we see to, patients' welfare, how they eat, how they sleep, make sure they take their medication. Each and every diagnosis that, various diagnoses that patients come in with, we treat them. Is a sort of individualized nursing care. And each patient is given the right, the right treatment that is expected according to the presenting complaint. But all we are after as nurses is that we treat these patients, according to what they presented with, that at the end of the day, they have the value for the treatment they have come to receive.
The role of the pharmacist is to provide pharmaceutical care. We are the ones that provide medications for the patients, because without medications coming to this hospital, you will not get the care that you need. So our drugs are basically an important role in treating the patients. So we dispense the drugs, we give the patients the drugs, we monitor the drugs, we make sure that the drugs are effective. We'll look at the interactions. We do pharmaceutical care. We go to the wards with the patients to make sure that the right medication is used for the right patient at the right time, and try to provide drugs that are effective. We tell them how to use their medications. We tell them the side effects they will expect from the medications. We tell them how to store their medications. We tell them if they have any side effects, they can get back to us. When a patient comes for the first time, we talk to them, we counsel them, and then we tell them to get an appointment to come back for follow-up, so we can discuss with them.
The list of those who play important roles in the healthcare delivery system is long. Aside from the physicians, nurses, pharmacists, medical lab scientists, and radiographers, there are physiotherapists, dietitians, occupational therapists, medical equipment technologists, medical records officers, and a couple of others. Most of the professionals in the health sector have science training background, with each spending different number of years in acquiring relevant education.
Minimum of 5 credits, including mathematics and English, physics, chemistry, biology. And then you go to a school of pharmacy, a faculty of pharmacy. Actually, the Pharmacists Council of Nigeria does not accredit people who do not have full faculty status, usually. And so you run a 5-year program. Well, it used to be a 5-year program. Today, the National University Commission has now approved a PharmD program, which has also been endorsed by the Pharmacists Council of Nigeria. The PharmD program is a clinical pharmacy program, which you run for a minimum of 6 years.
The level of education is just like any other person. That's 5 years in the university, and after you go for your we call it the internship for 1 year before going for service 1 year. Then other things will be other development like masters and the rest of them.
The amount of hours that we put into this 6-year course is equivalent to the number of hours that somebody who does normal BSc, does masters, and does a PhD in straight sets. In medical school, you stay 11 months in the school in every year. Sometimes you stay 11 and a half months which means that you have only 2 to 4 weeks of holidays in the whole year. The demands of the training is intense, is high, is serious, and that's because we cannot afford any delay, mistakes in medical practice.